and the press who may be watching the live stream of this meeting via the County Council's website. Members, you are now aware of the need to keep your video camera switched on for the duration of the meeting, unless there are, of course, technical issues, and to keep your microphone muted, except when I invite you to speak. There's always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment until the fault is addressed and the public broadcast will be paused. If it is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I please remind members and officers and also public speakers that all virtual meetings will be recorded and that these recordings will be published on the County Council's website. So, members, I will begin by calling the names of all the members of the committee to establish your presence. Please unmute your microphone and confirm that you are in fact present. So, Councillor Connor.
Present.
Thank you. Councillor Dupre.
Present.
Councillor Reynolds. Is he not here yet?
I don't think he is. Okay,
well, move on. Councillor Hay.
Present.
Thank you. Councillor Harford.
Present.
Councillor Jones.
Present.
Councillor Wilson, who's kindly substituting for Lucy Nessinger. Graham, you there?
Present,
Thank
Peter, and Councillor Graham Wilson, not to be confused with Councillor Sarah Wilson.
I did say Graham, didn't I?
You did, I beg your pardon.
Okay, thank you. You're definitely Graham. Yeah.
Thank you.
Councillor Smith, Mandy.
Present, Chairman.
Councillor Van der Ven.
I'm here.
Thank you. East Cambridgeshire District Councillor David Ambrose Smith.
Present.
Fenland District Councillor Sam Clark. Sam.
Present.
Thank you. South Cambs District Councillor Jeff Harvey. He may be late. Perhaps he's not here yet. Okay, we'll move on. Thank you. Cambridge City Councillor Nikki Massey.
Present.
Thank you. Huntingdon District Councillor Sarah Wilson, who's kindly substituting for Jill. Sarah, are you there?
Present.
Thank you. And myself, Councillor Peter Hudson. Thank you very much. We'll move on, please. Item 1 on your agenda is apologies and declarations of interest. Rob, can you update us on apologies, please?
Yes, certainly. As already mentioned, Councillor Lucy Nessinger sent her apologies and her substitute is Councillor Graham Wilson. And also, as already mentioned, Councillor Jill Taverner sent her apologies for both this meeting and the next meeting for December, and her substitute for today in December will be Councillor Sarah Wilson. Also, Councillor Jeff Harvey has indicated that I think he, as you indicated, he may be having problems because he's got another meeting, so he may only attend if he attends at all as an observer.
Yeah, that's great. Thank you. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest, please? If not, thank you, and we'll move on. Thank you. Item 2 on your agenda pack is the minutes of the meeting that was held on the 15th of October. We're being asked to approve these minutes held on the 15th of October as a correct record. Can I please ask if any member who does not agree to this proposal, please use the raised hand function now. Thank you. In that case, on that recommendation, we'll approve the minutes as carried, and I will sign a hard copy when and if ever we return to the hallowed halls of Shire Hall. Thank you. Item 3, which is pages 3 to 7 on your agenda.
Pam, can you take that?
Just wait till Rob sorts his domestic issues out. Thank you, Rob. And welcome, Kevin. Kevin Reynolds is here, so thank you, Kevin. Item 3, pages 3 to 7. It's a Health Committee minutes action log. The next item for noting is the action log. An update to the published version was circulated by email on Thursday, the 12th of November, and the revised version of the log itself was emailed to you all yesterday and also published on the meeting website. I do believe Liz, our Director of Public Health, will provide a further update on 5F regarding the plans being undertaken by the university to support those unable to return home. Liz.
Yes, and I can confirm, having spoken with Dr. Linda Sheridan, who is our Link Public Health Consultant with Cambridge University, that they are expecting some more students to be staying over the Christmas period, and that plans are in place to support those students and their welfare as they remain in Cambridge over Christmas and New Year.
Thank you. I'd just like to do a bit of a private mention, please, and a special vote of thanks to be minuted to our Vice Chair and the Hinchinbrook Liaison Group for their very effective work on their last liaison meeting at Hinchinbrook on the issues that was brought towards this committee last month. So well done, you all. Thank you very much indeed. Okay, so I want to, there are no petitions or public questions, so we go on to what would be item 5, but because Raj has to go early to make a phone call for a COVID-19 outbreak issue, I'd like to go to item 7 now, please. That's page 33 to 42 in your agenda pack. That's item 7, which is the aligning of age for counselling services to children and young people across Cambridgeshire and Peterborough. Raj is here, of course. This is a follow-up to the report we had last meeting, which we sent back with Raj to ask her that we weren't happy with the age stopping at 18 when we were, as a county, looking after them until they were 25. So we sent Raj away to come back with proposals that would suit us to increase the age to 25, even if it meant put a little bit more in the pot. And Raj is back, and the paper does actually achieve what we requested last time. So Raj, could you briefly introduce it, please?
Thank you, Chair, and thanks for summarizing that so well. So I think what I would say is that the paper stresses why it is important that we carry on funding the service up to the age of 25, but that would need a bit more funding from the Cambridgeshire County Council, 70,000, and this would actually bring it in line in terms of the ratio or proportionate fair share in terms of the total cost and the use of the service, with Peterborough and Cambridgeshire split being 30-70 as it should be. So I can go through, so that's the option 1, which is the first option, to increase it by 70,000. And we, as Chair has mentioned, we agreed last time on the CCG being the lead commissioner. We agreed on the model that would be used to deliver it, which was a single front door and integrated service. And we wanted to look at the 18 to 25-year-olds because, as said in the NHS long-term plan, there is an aim to have a 0 to 25 service which is integrated across health, education, and social care. The paper does go into the high needs in this age group, especially self-harm, which we know is an issue in Cambridgeshire. We've made that a priority of trying to reduce the amount of self-harm, which is higher than national. And this service would then focus on those young people and also other young people. So just to remind ourselves, this is the service that sits between the CAMH, mental health, specialist mental health services, and the universal services that are available. So this is a counselling service for children with mild to moderate mental health needs, children and young people. And it goes into the reasons why we think it's important to cover this age group. And although the current provider, CHUMS, has not had a very good uptake with this group of people, and there are other adult-focused services in this to cater for this age group, there are some young people who, as pointed out by committee members last time, do not sit very well or comfortably with the adult services, and this would enable us to provide a more youth-focused service with the issues that youth are facing increased with COVID, and have a more holistic service which looks at other issues like housing and debt and jobs and sexual health. So it would be a more holistic provision that could be more youth-focused. And I can take questions or go into any more details, if that's...
Thank you, Raj. Yes, I'd like to remind the committee we've got our friends for the NHS here for 2 o'clock, and they're very busy people. So we will finish this item exactly on time, please. So with that in mind, Linda.
Thank you. I hope that wasn't a covert message, because I was going to be brief, just to say that it's a very welcome revision of this paper. And I think 2.5 flags the needs gap, not just in terms of the numbers accessing services at the moment, but also the gap between what some young people can manage with the adult services and other young people can't. So being 18 to 25 means different things to different age groups. The second comment is just on paragraph 3.6, which is the realigning contributions. I think that's a very fair way to proceed. I'm really pleased that the County Council has put more resources into this, because we know that mental health, particularly in this era of COVID, is a key issue. So thank you.
Thank you, Linda.
Thank you.
Graham, Councillor Wilson.
Thank you, Chair. And I apologise that obviously I wasn't involved in the previous discussions, but the recommendation definitely makes sense to me. I've got a couple of queries, one about money and the other about unmet need. So in 3.6, as Linda has said, there's an additional £70,000 to balance up our contribution. Presumably that's on top of the £70,000, is it to enable young people to from 18 to 25 to continue to access the system, or is that just a one-off to balance it up? It may well be.
No, it is to keep the service accessible for the 18 to 25-year-olds.
Okay, and then in 3.7 then, Raj, it talks about at the bottom, there is evidence of significant unmet need for this age group. So what is meant there, and does that imply that the long waiting lists and issues about what the service people are going to receive in the future is not going to be addressed?
So I think what this service would do, and we had the model last time, was there would be no wrong front door. There would be a single point of access where young people or across the patch would get triaged, and either while they're waiting for maybe a more one-to-one counselling, there would still be online counselling till they get, and it would reduce the waiting list considerably. So I think the CCG has also increased their contribution. So it is £500,000 from the 2 local authorities and just about £500,000 from the CCG. So the funding envelope for this service would be increased overall, but there would be some more of online. There would also be lower tier children's wellbeing practitioners doing some more of the face-to-face interventions. And yes, so I think, I'm not sure which on 3.7 there is about, there is also evidence while there are other services. I think this was just to say that although there are adult services in the 18 to 25-year-olds which they can access, we think that we need this for the young people who don't access that service, the adult service. So I think higher up in the paper it talks about a lot of services for that age group which young people have been accessing.
Okay, sorry, Peter, if I may come back. Yeah. On the CCG, it does say they're increasing the investment to 365,000, but this is not new funding, and it comes from integrating other services. I'm always worried when people say that, because to me it means that other services are being squeezed or cut in order to release a small amount of money on here. And can we have an absolute assurance that where there is this significant unmet need, it will be met in the future, and that can come back to committee as a report?
Yeah, definitely. Once the service starts, we'll update. I think what's happening is, rather than having small little pots of money going into various different services which were all working in silos, it'll all come together into this one integrated service, so that there isn't anybody not having any intervention or not having any help. And the pathway will be right through from the lowest level to the CAM8 specialist service.
Okay, thank you. Susan, please.
Thank you, Chair. Yes, I wanted to thank Raj really for all the work that's been done under a lot of pressure to answer our many concerns from the last Health Committee meeting. It's really good to see the paper fleshed out in the ways that we were concerned about, and to have the information on the CHUMS inherited waiting list, and the sheer scale of that list tells us a lot. I'm obviously delighted that we're in the framework of the 0 to 25 aspiration in the NHS long-term plan. That just seems, it seems that we've got our radar on the right way now. So very happy to support the recommendation.
Thank you.
Thank you, Susan. Lorna, please.
Thank you. Like Graham, I kind of wanted some clarification. The recommendation is actually an either-or option, that we either do the one thing or we do the other. The paragraph 3.7 of the report says that option 1 is the recommended option, but the recommendation itself is not entirely clear. There's the outcome on that front page of that report gives 2 options, and the recommendation doesn't specify how the aim is actually going to be achieved. So I'm assuming that the recommendation before us is the first option, to increase the contribution.
Yes, yes. Thank you. Sorry,
that clarity. But the second point is that this, as I understand it, if it's a rebalancing of the fund, it doesn't actually increase the overall pot. And if it doesn't increase the overall pot, then I'm not clear within this report how that significant unmet need is going to be addressed with no additional funding.
So we are hoping that by bringing it all together with the children's well-being practitioners and the online counselling and everything coming together, there'll be some efficiencies, and that's
right.
And with a integrated service rather than this separate siloed service. And people not going around in different, saying you don't meet our threshold and being sent somewhere else. Because a lot of time gets wasted in that, and a lot of people are sometimes referring to 5 different agencies and different services, and people getting bounced around. And some of the waiting list is because they're sitting on that waiting list, and they're also sitting on a CAM8 waiting list, and they're also sitting on some other waiting list. So I think by bringing it all together, that, and someone doing a triage, getting it right first time at that single first assessment is what is the aim. So I think by reducing that bounce and duplication and confusion in the system, we hope that it would solve a lot of the problems that we currently see in the system.
Okay, thank you very much.
Thank you, Raj. Sarah?
Thank you, Chair. Just to say, I think that option 1 gives the best outcomes for our young people up to 25, and therefore that's a clear-cut decision. I have a moral question, which I'm not sure if it's appropriate to ask, but Peterborough will be contributing less money, but I would like some kind of to feel good inside that Peterborough young people are not going to be offered a lesser service, because it's very unusual for anybody to pay less and get the same service. And it worries me. It's maybe an inappropriate question to answer here, but it's in my head.
So
It's a good question.
Just to say, because the CCG is Cambridgeshire and Peterborough wide, it will be a single service specification across Cambridgeshire and Peterborough, irrespective of what the contribution is. I think it would be that the same service, the service specification will be exactly the same across the patch.
Chair, may I come in?
Yes, Liz, yeah.
Yeah, there are more children and young people in Cambridgeshire than there are in Peterborough. So although it's less money, it's the same sort of level of money per child. So actually what we've done is to make the funding much more equitable, whereas previously it wasn't equitable, because actually Peterborough was putting in more funding than the activity from the service that they were seeing. But actually the funding is equitable now, because there are fewer children in Peterborough than there are in Cambridgeshire.
Thank you. So the initial decision of the split of the funding was not the best decision when it was made, whenever it was made, but now we're correcting that.
Exactly.
Thank you.
Yeah.
Thank you.
Exactly right. That's why the paper that we had last meeting was sent back to put that correction correct. And that's what we have. Okay, guys, so we're asked to ensure that there is a counselling service that goes up to the age of 25 for our young people, with the additional funding to make this feasible, which will be £70,000. The option one is what we asked them to produce for us. So I'm going to go, please, for option one, to increase Cambridgeshire County Council contributions by £70,000, enabling young people aged 18 to 25 to also be able to access the counselling service for children and young people. If there's anybody, Sarah, you've got your hand up still. Would you mind taking it down? It's still there. Thank you. It's come back. Thank you. If anybody is not of that opinion, could you raise your blue hand now, please? Thank you. So let's take that, please. We'll take that. Option one, Raj, thank you for your extra hard work to bringing this paper to us, to give us exactly what we asked for. It's very much appreciated. Thank you. Best of luck with your phone call later, my dear.
Thank you.
Thank you, members. Now we go back, please, to item 6 is our scrutiny item of the Cambridge Children's Hospital project and engagement update. As there is the expectation that the members, more than an expectation, I would suggest, that members will have read the published report that was kindly provided in advance of the meeting, can I please ask the presenters to keep their introductions as short as possible and just highlight any key points they may want us to look at particularly. And I understand this also includes a couple of short videos. So let's welcome our guests, our friends and our guests from Addenbrooke's to the meeting, who will either be presenting or on hand to answer any questions on the report. And I may need to draw breath there because it's rather a long list. They include Rob Houchkill, who's the Clinical Director of Children's Services at Cambridge University Hospital NHS Trust, David Rotich, the Head of Paediatrics at University of Cambridge, Kathy Walsh, Consultant Liaison Psychiatrist and Deputy Medical Director, Cambridge and Peterborough NHS Foundation Trust, Sarah Vincent, Head of External Affairs at Cambridge University Hospital, Annalise Lister, Communications Manager at Cambridge University Hospital, Andrea Grosbois, Head of Communications at CPFT, which is Cambridge Peterborough Foundation Trust, Alex White, Project Director, Nikki Murphy, the Assistant Director of Major Projects, and last but no means least, and equally as welcome, Yesterday, Kinghorn, who is the head of partnerships and improvement at NHS England. Now, we all know how busy our friends and guests from Addenbrooke's are. This item is limited to a maximum 40 minutes. So I would ask the committee to bear this in mind to allow them to leave us in 40 minutes time. Thank you. Now, can I please ask to make your presentation with whomever wishes to go first? Thank you, Addenbrooke.
Okay, thanks very much, Peter, for the invite. We've got a couple of slides that I hope Sarah is going to share with you to give you an update, really, of what's been going on the Children's Hospital project. And despite, of course, all of the challenges that we faced over the last 6 months, I'm pleased to say we have continued to make progress despite everyone's distraction. So as you'll see from the first outline, the first slide, I'm just going to walk you briefly through where we're at with progressing this project. So remember, we're about 18 months since the £100 million was awarded from Matt Hancock. We were pleased to have a very productive discussion with NHS England back in April, where they signed off our strategic outline case and therefore allowed us to draw down capital for progressing with the outline business case, which is what we're at now. In fact, they were very minded to ensure that we went on to do an outline business case for a fit for purpose building that was going to include and consider very much the challenges from the region, as much as future proofing and potential repatriation of patients outside the region. And so we did a piece of work with healthcare planners over the summer just to re-look at the scope of the building to ensure that what we end up with is both affordable but also addresses some of the key issues that are important for the region. We've done that piece of work, and we're delighted to say that we actually this week are interviewing the top 3 design and construction teams that we have taken through a tender process with the potential to award the winning team, hopefully at the end of this week or next week. That then sets us off on a design and construction program with stakeholders, with staff, with the region, with children and families over about a 6-month period, during which we will work up the sort of greater detail of the project and hopefully be ready to submit a completed outline business case in the middle of next year. There's an awful lot of work to be done. Andrea is going to tell you a bit more about the engagement efforts that we've made locally and regionally. It's also worth mentioning, I think, that we in October were able to progress our long-standing wish to begin to deliver children's retrieval services in the region from Cambridge, and that'll be in partnership with the CATS retrieval service that runs out of central London. We will be able to, from April next year, begin working with them to retrieve more quickly and effectively children from Norfolk, Suffolk and Cambridgeshire to the Addenbrooke's intensive care unit, rather than relying on what you might imagine is already overstretched service out of Great Ormond Street in these difficult times. So it's another really key element of the requirements for a children's hospital is developing a region-wide retrieval service, and that'll be aligned with our neonatal retrieval service. So I think a decent amount of progress. Happy to take any questions on that in due course, but hopefully we're on target for an outline business case in summer next year. And remember, the closing date or opening date of this whole project is still the middle of summer 2025. Thanks very much. Over to Andrea, I think.
Yes, hello. So there's quite a bit of detailed information in the paper that we've submitted, so I won't go through that again. But just wanted to highlight there's been quite significant engagement to date, using a lot of the existing forums that we have out there, working with the third sector and engaging with our patients that are already on our wards through a means of different channels. I'm sorry, next slide. So we've done quite a bit of work in using creative ways, using art as a way of engaging young people. So for example, we did quite a bit with children on the mental health ward, charting a day in their life on one of our wards. What are their feelings that come up? What's really important to them at each point of the day? And what that's done is really made it clear to us that actually what's really, really important to them isn't something we'll know unless we talk to them and we engage them and we embed them really in the design and clinical model for the new hospital. So for example, something they said that was really, really high priority for them was making sure that they could still see their pets, even though they're in hospital, somewhere that they can see their dog. That's a really, really top priority, which might not have been something that we would have known had we not had that intense engagement with them. Sorry, next page, please. Yeah, this is just a brief photograph of an event that took place last year, working together with the third sector to engage children with special educational needs through the organisation Family Voice. So I think it's really about how do we engage people through existing channels, making sure that we're getting a broad and diverse representation of children and their families' voices throughout the project. Sorry, I think on my last slide, please. So our approach to how we're going to be engaging from now is, as detailed in the paper, the use of existing networks is really important. So linking in with organisations that already have really good young people and parents forums. For example, things like the Speak Out Council, they've got a really engaged group of youth who have got potentially, special educational needs or learning disabilities. They run that engagement really, really well. And we want to go and talk to them and work with them to hear about their views around accessibility of the building, just as an example. And also using our internal forums that we've already got with our existing patients. The other thing we're going to be doing is launching a brand new youth network and parent network. And what we want to do is give people the opportunity to be involved and really be part of the decision making around the new hospital, both young people and their families. So detailed in the paper we set out is how we're going to do that and how we're going to be working across the project with young people and their families. We've just got a couple of videos that we just wanted to show you about some of the work that's taken place so far.
So this video is a short snippet of some of the activities that we did with a group of young people involved in helping us understand the design teams who have applied to design the new hospital. So we had several Zoom events, and we've put together this very short compilation to show you some of the things that the young people got up to, and it was facilitated by a creative artist that we know.
Don't know if anyone else can hear, but it seems to be on mute.
Yeah, it's definitely on mute, but we can see people bodding about, can't we?
Can you hear me?
We can hear you, but not the video, Sarah.
Ah, right. I'm not sure why that is. Let me go out of here, and oh, what a shame.
No worries.
Oh, it's such a shame though if you can't. Let me see if I can just get out of here and alter anything.
You maybe not on full screen. I don't know whether that's.
I'm going to take out my microphone in case, and I'll just go on in case I. Right, let's see if I can play it now. Can you still hear me?
Yeah.
Yes.
Okay.
Hello, Any good?
Not
It's like
great.
they're in water, isn't it?
No.
Very distorted, but no, I can't hear anything now.
No.
Oh, okay. I'm sorry about that. Will I have to stop?
I think so.
Maybe try the second video. See if that's
Yeah,
working.
I'll try this one then. This is Alicia, who is our communications and engagement champion, who's working with us, looking through our materials to give us a young person and a user's perspective. So let me try and show this one.
No.
Right, I've got one more thing to try. If I can, oh, I'm so sorry. It would have been really good if I can just see if I can do. Tell you what, would you like to do some questions? And in the meantime, I'll fiddle with my settings. I think there's a button I can find where I do share sound, and that should be okay. But if you want to do questions in the meantime, and perhaps I'll try at the end to show you these videos again.
Okay, yeah, that's fine. Let's go with that because time is getting on, isn't it? Let's start, members. Linda, Councillor Jones.
Oh, thank you. It's very interesting, and the paper was very interesting, so don't worry too much about the videos. I think we've got the picture. As I understand it, this is an East of England resource, and Eastern England is the area it will serve. And I was sort of slightly surprised to hear it called the Cambridge Children's Hospital. And when I read the paper, although less so in your speeches, I got a very strong sense that this was a Cambridge focused project. Now, I do understand that Cambridge University is putting resources into this as well, but I do think you've got to be really careful to make sure that in your networks, you are demonstrating, not just that you are, but you're demonstrating to us that you're sort of reaching out, not just across the whole of Cambridgeshire and Peterborough, but also more widely across the east of England. So that would be my first comment. I noticed that nearly half of your patients come from outside Cambridge and Peterborough. The second one I thought was interesting, which was, in a way, what you're trying to do is to redefine what you mean by a hospital. And this has great salience for us, I think, in public health. You talk about it as having a focus on prevention, the hospital, and an early intervention. And I know from the long-term plan, the Simon Stevens plan, that the boundaries are being blurred between what has been more traditional kind of public health and what is sort of early intervention, prevention in clinical terms. And I'd be interested in any comments you have on that. And in particular, I think from the point of view of Cambridgeshire, how you see that aligning with all the excellent work that public health is doing already, because that's going to be extremely important. What we don't want to do here is set up rival camps where public health is doing something in its side of the field and the hospital is doing something in its side of the field. And I had got a sense in that 10-year strategy that actually that was appearing to be the case a little bit, that somehow if you just had early intervention, early diagnosis in a clinical setting, then in a way that was what was important. And the third point is just a small, but one that I notice is not there in the Children's Cancer Hospital, in the Cancer Hospital either. But it did come through very, very strongly when you talk to staff, and that's about car parking and access. And that is a key issue on the Barnet Medical Campus. And I speak as a Cambridgeshire County Councillor, but Cambridgeshire County Councillor representing Cambridge, in a Cambridge area. That is a key issue. And we have to find a way of doing this. And this is not just about having a rail station there or having a bus service there. It's about the hospitals, I think, being crucially involved in encouraging and supporting and enabling through, I don't know, voucher schemes or whatever, people to travel in other kinds of ways. Otherwise, as I know from the work at Papworth, we're simply going to get queues around the block for the available car parks, and it's all going to grind to a halt.
Thank you, Linda. I'm happy there's a ton of questions in there, so I'm happy to kick off and start the ball rolling. So you're absolutely right that this is a regional offering, and actually, at least on the physical health side, 70 or 80% of our patients come from around the region. So we are going to work very hard to make this of benefit to patients and staff around the region. And there's a number of ways that we're hoping to address that. We've set off now our clinical reference group, which invites operational, clinical and nursing staff from all the units around the region to take part in discussions specifically around pathways and pathways of care. There's a number of paediatric units that actually have got plans to redevelop themselves as part of HIP2 government funding. We're very keen to get into and have a work stream aligned with that, to get into understanding how we can share patient pathways across the developing units. What aspects of care could we provide much closer to home? What aspects of care could we provide education and training for local staff to deliver in home units? So it's not only around sort of patient care pathways, but it's also around education and training and developing the sort of digital platforms that will allow us to keep patients at home and out, away from Cambridge and away from the car parking problem. We've engaged on the physical health side with a number of the trusts several times over, to be honest, in the journey for the Children's Hospital, and most recently before the pandemic. And actually, some of the feedback was, not to call this an East of England Children's Hospital, because there are other hospitals in the East of England, and actually it's a hospital in Cambridge. And therefore, that's what we should be doing. There's also no small philanthropic challenge of raising £100 million, and for us to go out internationally with the University of Cambridge and not have Cambridge attached to the name somehow would be extremely challenging. So we absolutely do want to make this a regional asset and very much a part of that. And we will develop the sort of interaction with both children and patients across the region, but also with clinical staff across the region to try and get them, very much engaged, with the outset of the design and construction progress. I don't know whether some of my colleagues want to talk to question number 2, which was around early diagnosis and prevention. I mean, I'll start off perhaps just by addressing that, Linda. I think the focus that our offering hopes to bring is the more sort of basic science, genomics, early detection of mental health in childhood, early detection of rare disease in childhood. On the one hand, on the sort of university strength side, versus a supportive element that we would want to play with Best Start in Life, with the community paediatricians in supporting the sort of early intervention in the community in areas which are well described. And where the intervention needs to happen in the community a long way away from a tertiary medical facility. So I think whilst we want to be part of that discussion and bring whatever energy we can and support we can to early community intervention, I think the main focus, for example, children on the neonatal intensive care unit who would otherwise have a rather protracted journey of diagnosis through various services, are now having whole genome screening carried out in the first 2 weeks to make an early diagnosis, to allow us to repurpose medications, interventions, and therefore, not only make their sort of investigation course much shorter, but also allow effective treatments to be brought to the table earlier. And I think there's real potential in diabetes, in mental health, to bring the power of the academic side to children that we are confronted with, while still having an eye on supporting the community. Kathy.
Yeah, thanks, Rob. I just add a little bit to that about mental health. So I'm Kathy Walsh. I'm the clinical mental health lead. I'm a psychiatrist. So one of the things that we're very keen to do is change life trajectories for children. So for example, in mental health, we know that 75% of mental illness starts. So if you look at adult mental illness and you look back to the origin, 75% will start in childhood. And one of the sort of academic offerings is actually looking at the impact of childhood adversity on predisposing to adult mental illness. And that's not just psychological, but biological research as well. So that's a very important academic offering. We're also looking at data linkage. So there's a current project going on, which is looking to triangulate data about children from social care, education, physical health and mental health, and across the organizational boundaries, so in primary care and secondary care, so that we're not just confining this to the perimeters of the hospital, if you like. And we also have going to the kind of more regional aspect. One thing to say about mental health is that we currently provide 3 nationally commissioned wards. We are moving to something based on an initiative called New Care Models, where we're going to be in a collaborative with a number of providers around the east of England. And between the main providers, we will be deciding where beds are based and what services should look like for children in the east of England in the total. So we know already that we will be the main providers in Cambridge for eating disorder beds, but other beds will be elsewhere in the region. I think the other thing to say is that we have the strapline Hospital Without Walls, and that really refers to our ambition around the use of how we use technology. So for example, at the moment, COVID, even though it's been very, very challenging, has actually led to some changes in practice. It's really accelerated our use of digital virtual consultations. So in CAMS, for example, child and adolescent psychiatry, 75% of outpatient consultations are now taking place virtually. So this is a very good way to not just reach patients, so children, young people and their families, but also to reach clinicians in the peripheral hospitals. So for example, we have this call at the moment, the idea that all these people, I mean, you might be very good at all getting together, but certainly our meetings, the attendance has really grown hugely, and that's really fantastic. You know, I've had several meetings already today with multiple people who would normally be very difficult to get in a room together, plus we'd have all our travel time. And finally, public health, we are really keen to work with our stakeholders. Public health are very much part of that. I see Liz Robin on the call, and we've certainly had some initial meetings towards the start of this project. And it's absolutely essential because, you know, we can't do this on our own. This is about an initiative for the entirety of the region and requires social care, it requires primary care, it requires public health, mental, physical health. So we really see this as a partnership initiative, not as something that just we're doing on our own. So I hope that partly answers your question, Linda.
Yes, thank you. And do move on, please. Thank you very much. That's a very full answer.
Is it Councillor van der Ven to speak next?
Thank you. Thank you very much. Yes, I also had my attention drawn to the car parking and travel section. It's ironically posed just next to your net zero carbon paragraph or 2. And I think there's a lost opportunity here. Your net zero carbon aspiration is about buildings, but surely you're thinking about the whole picture. And the 2.8 section on car parking and travel, I think probably misses the full picture of the challenges of transport to the biomedical campus that is the reality and has been a source of many headaches for many people planning or using. So I think that whole it's an opportune moment. Really take that net zero carbon aspiration and apply it to access to the site, and use it to push for all the things that we know we need. And if we can't just be talking about the last mile either, if this is a regional hospital. So I hope that can be pushed up the agenda. Thanks.
Thank you. Can you go straight on, please, to Councillor Hay, Anne?
Hello. My question is, it says in the paper that you've had 100 million of public funding, but to deliver the hospital, you need to raise about 100 million through philanthropic support. How confident are you that this target can be met? And should it not be met, what is the alternative plans?
Yes, I'm happy to start that discussion. To be fair, Anne, I think we would still feel that we are very confident in meeting the £100 million target. Not surprisingly, COVID has caused some issues with that, but the people who are advising us, our campaign board, feel that it is very much within reach, in that it clearly isn't something that we're going to ask the regional committed patients and families to raise. This is something that we will have to get nationally and internationally. So we are working with the alumni office of the university, and we have a growing campaign team that is working together between CPFT, CUH, and the university on raising this money, 50% of which is for NHS facilities. And we remain bullish. We've had a feasibility study done that felt this was within reach for a children's hospital in Cambridge, that was innovative and was pushing the sort of novel integrated mental health option. So we're not giving up. There have been some good signs of from our fundraisers of good potential. So we hope that within the 6 months time span of the outline business case, we will be able to give some great news that will give the Department of Health enough confidence to let us proceed. If we don't reach the final envelope, it depends a little bit on where we're short. There will be contingency planning for the university if they don't reach their full sort of expected 50 million section. And the design discussions that we've had with the teams just this week will have focused on the sort of alternative options if we cannot fund everything in one piece. So either phasing, providing shell and core that we can build out and into, whether that's on the university side or the NHS side. But we do feel that it's still a fundable cause, if you like.
Thank you. Finally, Councillor Harford.
Just very quickly, because I know you're tight for time, I just want to say that as the Health Committee's representative, who meets regularly with all the representatives that are here today, I just wanted to say that it's really important that we understand that my concern was exactly as was articulated by Linda originally, and that's something that I have been constantly talking to all the group about, all the board about, and I don't think that that the funding issue, I think, is really sad, because this is the only region that doesn't have a dedicated children's hospital for the region. And unfortunately, the way government funds is basically through match funding. I have every confidence that the board will be able to raise the money. And yes, like Linda, I was concerned about it being badged under Cambridge. But I think that Rob has very clearly articulated why that is necessary, because if that funding is going to be raised, sad to say, it is the Cambridge name that's going to take it there. So I'll stop there, because I think that between them, they've given us a really good picture. And I thank them for all the time they give me when I attend meetings with them on a regular basis. And I am watching out for all those things that concern you, don't worry.
Thank you, Linda. Members, is there any other questions before I close this down? Yes, Sarah?
I just wanted to ask the councillors whether they're happy with our level of engagement and what they would like to see from us going forwards, because we have fantastic support from Linda and from Nikki. And is that the right level? Would you? I mean, we'd like to come back on a more regular basis to talk to you about things as well. So, what would you like from us?
Does anybody want to come back on that? Because I mean, I will say briefly that Linda will keep liaising with you on our behalf. And yes, we too would like you to come back on a more regular basis to give us regular updates on how you're getting on so far. Councillor Jones, please.
Yes, I absolutely agree with you, Peter. I mean, one of the interesting things is that in the previous paper that we had from Raj was, of course, about mental health and community mental health. And when I was talking about the relationship between hospital and community, I think there needs to be an awareness of the range of what is going on. And I'm not convinced yet, actually, that you've got that. So I think understanding more about what public health is contributing, which isn't, to put the whole burden on Liz, who's got so much else to do, I think would be really important going forward, because I think you've got a group of councillors here who are influential in their own divisions and can actually help or not help, as the case may be, to get this hospital delivered.
Thank you, Linda.
Can
Sarah, would you like to go back on that a little bit?
Sorry, me. No, I was just saying thank you for that contribution. Sorry.
Okay, thank you. Raj, you want to say something?
Yeah, just to say that we have worked quite closely with CPFT on developing some of the proposals for moving forward.
Thank you. Thank you. And we'll discuss this at the next chair, vice chair, and lead members, when we could put down and plan when perhaps we'd like to see you again. I'd just like to thank you all for coming. It's been really, really good. It's all very exciting. And it's a shame I'm not going to be sat in this chair when you cut the ribbon, but I would still like to be there. So thank you all very much indeed.
Would you like me to try one more time to show you the videos, or do you not have time?
You've got 2 minutes if you want to.
I think I know what I need to do this time.
But hello, and welcome to session 2 of the people test. We are coming up with ways to take part in the architects interview, the architects who are going to be building the new children's hospital.
I think what we have to task ourselves with is testing them on how well they communicate with young people.
I want to play this game, which is where you were given like a picture in front of you. There's 2 people.
Oh. Sorry, I'll go forward.
Hi, my name is Alicia Bakari, and I think it's really important for children and young people to be involved in the Cambridge Children's Hospital project. This is because it gives young people a voice to share their views, and obviously when you're building a hospital that is curated for children, it's practically ideal. That's also how I got involved, because due to my lived experience of being in long-term hospital care, I decided to create a PowerPoint and share it with a group which I volunteer at called Active. They help improve services for children and young people across Adamcross Hospital. So I shared it with the leader of the group and they passed it on to the project team. The project team happily liked my PowerPoint and they've since appointed me to be their new comms champion, and I've been involved with their projects, several projects to date, such as interviewing architects and looking at leaflets and pamphlets. I'd like to be involved in every step of the process, and I can't wait for the new Cambridge Children's Hospital to be built and to finally open its doors to the public. Thank you.
Sorry about the first one. You obviously can't move to full screen while you're sharing. Apologies, at least you heard the second one. Sorry about that. Thank you.
Okay, well, thanks very much. I'd just like to thank you all again for attending. It's been absolutely great, and we look forward to seeing you again soon. So thank you very much indeed.
Thank you. Bye-bye.
Thank you very much.
Goodbye.
Thank you. Bye-bye.
Members, could we please now go to the next item, which would actually be item number 5, which is the public health response to COVID-19. This report was circulated on an email to the committee and published on the agenda page website on the 17th of November. And I used my chairman's discretion and I accepted this as a late report on the following grounds. That is, to allow the report to contain the most up-to-date information possible and to enable the committee to be briefed on the current situation in relation to Council's response to COVID-19 for those services for which it is responsible. So can I ask our ever-busy Liz Robin, the Deputy Public Health, to introduce the report briefly, please? Liz, thank you.
Thank you, Councillor Hudson, and I will be brief because you have the paper in front of you. So I'll just pull out some key points for today. So the first point is that across Cambridgeshire, we have seen quite a steep rise in cases reported recently. And that increase in cases, we are confident, really came from what happened in the week before lockdown. So there's evidence that we did see some pre-lockdown behaviours that have resulted in quite a sharper than normal rise, faster than normal rise in the increase in cases. And that's taken us up to the figures that you see in the paper. We have another couple of days data since then. There's been a little more rise in Cambridge and for Cambridgeshire as a whole, but the basic pattern of cases remains the same. So clearly of particular concern is the picture in Cambridge, which has seen the steepest rise. And I do appreciate that some local residents are concerned about this. The reassurance that I can give is that the high figures in Cambridge are mainly in young people aged 18 to 24, and that we are very much aware, as it says in the paper, that many of those cases are in Cambridge University and are students. What we look at very carefully is cases amongst older people aged over 60 who are more likely to become ill. And it's a very real concern that the infection rates could start to grow in that cohort as well. When we had the first rise in cases at the university a few weeks ago, we didn't see that. We saw cases rise and fall in the younger age group, but we didn't see a big transmission into the older population. We're working very closely with the university. Dr. Sheridan, who's my lead for this, literally meets with them on a daily basis, sometimes more than once. And we are confident that the university is isolating all the right people. The students are cooperating well, and that everyone is working very hard together to take the right public health measures and contain this increase and stop it spreading. So I can say that I'm confident in the processes the university is using. I'd also like to bring to your attention the Local Outbreak Engagement Board, where Councillor Hudson represents us, and this can be viewed on YouTube. We have the link in the paper. And that board really encouraged us as officers to develop a strategy to be in the right place when coming out of lockdown. So officers have been working hard on this and the associated communications. A key area of development work has been working with our district council colleagues and wider partners on local COVID-19 action plans. And we know that working at that district and city level is key to engaging with local communities. So those plans, we now have agreement, are jointly signed off by the District Council Chief Executive and by myself as Director of Public Health, so are fully integrated with our system-wide planning. The other thing I would just like to flag is the government announcement, obviously, around the lockdown, which we are now in. Everyone's very aware of that, and we are watching the impact of that. It's a little too early to really see the impact in our figures. We won't know the full effect until the end of November, because there's a lag from infection to someone having a test, to that test being reported through in the statistics. So we're watching that very carefully. Associated with recent events, the government has announced the Contain Outbreak Management Fund, which is a fund of £8 per head, and for Cambridgeshire that will amount to over 5 million to spend on our outbreak management initiatives and work by the end of March, by the end of the financial year. So that means that we do have the resource to work hard to engage with communities, communicate, support people to self-isolate, and provide real support to help anyone who needs to self-isolate to prevent the spread of infection. Absolutely clear we want to do that. And to make local improvements in our testing and contact tracing systems. So really, I just say to councillors and to the public, it's essential that people observe this lockdown, that really COVID-19 is spread by contact between people, social contact between people. So for everyone to minimise those social contacts is during this lockdown period and beyond, as we come out into the festive season as well, I'm afraid, that is absolutely key to stopping the spread and turning this round. So I'll end on that note and very happy to take questions.
Thank you, Liz. I'll just give a couple of things first. You say the rise in Cambridge City is 102% on the previous week, which is quite alarming, mostly due to the 2 universities within the city, and the older generation did not rise. There is not a rise in cases. Do you think that's because the older generations are frightened of the younger generation, so they're sort of making themselves prisoners in their own homes because they've seen how the younger people are going about in Cambridge, so they're frightened to go out? And my second thing is, I've been told quite a few times by several people that they believe there are some shops and retail business open that perhaps ought not to be. For example, in Ely, a souvenir shop was open. This was just over a week ago. And for the life of me personally, I can't see why somebody would need to buy a souvenir of Ely at this particular time. So I can't see why that retail outlet should be open at all. Thank you.
I think there's a very good questions, Councillor Hudson. In terms of the older people in Cambridge, I think it's difficult for me to give a definitive answer because I haven't conducted a survey of those older people. So we don't have the definite evidence, and perhaps councillors would be better placed than me to talk about what their communities are saying. What I would say is that Cambridge is a community where I have observed that many of the residents are very keen to follow the latest statistics, the latest research evidence, exactly what's going on. And I think older people who are following the COVID-19 rules, avoiding crowded places, avoiding closed indoor spaces, particularly where they have contact with people that are not in their household, and are generally avoiding close contact. Those older people are doing absolutely the right thing, and they're following the research evidence. So I'm not sure whether it would be a frightened thing or whether it would be a population that is actually very carefully following that evidence. I couldn't really comment further on that, but I would say that by doing those three things, they are absolutely, they would be absolutely right. So in terms of shops which are not selling essential goods, I would say just slightly anecdotally again, and not just in East Cambridgeshire, but right across the piece, we found at the beginning of the lockdown period that I would say a number of shops were testing whether they were essential or not. And environmental health officers in most district and city councils were in contact with those shops and having those conversations. And a number of them have since closed down. Even some national chains were testing it. But if there are shops which councillors, such as the one you describe, where councillors become aware that there is that issue, that they appear to be open when they're non-essential, then do please get in touch, either directly with the local environmental health or with the public health team. We'll make sure that that information is fed through and that a visit is paid to that shop, so that if they're open when they shouldn't be, then that will be acted on.
Thank you. Just going back to the elderly people who perhaps they're frightened to go out because of the crowded places. Surely we shouldn't have crowded places at the moment. That's the issue, isn't it? If there were no crowded places, then there wouldn't be the social interaction to spread the disease.
Yes, I mean, the cases that we're looking at are the pre-lockdown phase. So that was at the point where we had the rule of 6. We didn't have the lockdown measures in place when most of these cases became infected. So we are looking at a much earlier period. And I agree with you, places become crowded because people crowd together. And that's behaviour that we shouldn't really be following. But I think that should, now that we're in the lockdown phase, the regulations are much more explicit around that. And we need to observe the impact of the lockdown as we move forward. And we're watching those figures every day, because the impact of the lockdown will be becoming more and more apparent as we move forward through November.
Thank you, Liz. Are there any questions, members, to Liz? You all seem very happy with what she's given us, of course. Oh, here we come. Councillor Jones, please.
Thank you. I just wanted to concur with Liz's comments. I think that there's my division, as you know, is sort of central Cambridge, and I sense a level of anxiety among older people, and also a level of curiosity. I mean, a lot of people email me and say, what do these figures mean? How are they going to change? And all the rest of it. And I'm very grateful for Liz's clarifications about some of those issues. I would say that on the whole, and we're one of the fortunate areas, 2 areas in my division have got some of the COVID emergency schemes in place, in particular along a very busy shopping street, Mill Road. And that has made a difference. I mean, it's an imperfect scheme, as these emergency schemes always are. But one of the things it's doing is it's cut down traffic, encouraged more cycling because it's active cycling, and given some refuges to pedestrians. And I do notice that as you walk backwards and forwards, people actually move out of their way. I also noticed over the last couple of weeks a greater use of face masks. So I think Liz is right. I think older people are kind of curious, cautious, but also anxious.
Thank you. Councillor Massey, please.
Yeah, so I also live in Linda's ward, and I'm seeing a greater use along Mill Road, as Linda said, but equally so, what I'm noticing, because a lot of the time, my husband, as you may or may not know, works at Adam Brooks, and he's working very late nights because of the COVID pandemic. And so quite often I will be out on Mill Road going to get something for supper quite late at night, because he said, actually, I would like to have whatever it is he would like to have to eat that night. And that's fine. But what I witness is not, I wouldn't say groups of students, but when I'm standing still and you can hear the conversations going past, you can hear somebody on the phone yesterday was saying, so what bottle of wine would you like me to go and bring to your house? And we'll have a drink together. I was thinking, not allowed. Obviously, not my place to tell them they're not allowed. Two other girls were walking down the road with another bottle of wine, saying, "Well, my boyfriend said he's going to come to my house at this time." So the fact that I was only on there for about 5 minutes, and that was 2 conversations I heard, is pretty evident to me that some of the students that we have are not abiding by the rules. But that is also equally evident by the number of increase in infections that's happening, going back up in the Cambridge University. And the reason why I would imagine it's going back up is because maybe the students are getting a little bit fed up of being kept in their bubbles, and are using the opportunity to come out of their bubbles and interact. My concern that I've got is not necessarily with the students that we have now, it's the returning students. And as we know, the government have said that all students need to be returning to their hometowns by the 9th of, is it the 9th of December? Now, not all, Cambridge University is very lucky, it has its own testing. So therefore, their students will be tested before they go home. ARU doesn't have the same, and therefore it's relying on the NHS. And we know that not everyone is likely to be tested from ARU. And if that's the case from ARU, then that's the same case for all the universities across the UK that will be bringing our students back home. So my concern is that it's not necessarily about what's happening at the moment. When we talk about the 2-3 week lag in infections going up, you can calculate that the next potential rise is actually at Christmas. And it's from the students returning back into the homes and then added onto that, the mix. And so my question really is, what can we do? What extra messaging can we do to help prevent that, or at least minimize that? Because obviously we are reliant on government restrictions and guidelines. However, we can put our own messaging out to see if we can try to minimize it, at least within Cambridgeshire and Peterborough, because I think it's a real high concern that I have, is that we're going to get to Christmas and it's just going to...
Thank you, Nikki. Yeah, thank you. Absolutely. Really, really good questions. And I've seen that myself. Before Liz comes back on that, can I remind the members, please, that we have 10 minutes left on this item, because Liz also has to go and take part in a very important meeting, albeit on the telephone. So we only have 10 minutes. So Liz, do you want to come back on Nikki, please?
Absolutely, and I think really good point, Councillor Massey. I would say that the rise amongst the 18 to 24-year-olds is not entirely amongst students, so possibly the young people on Mill Road would not necessarily be students, particularly if they're talking about going to each other's houses, or not, because many of the Cambridge University students are living in the colleges, but certainly the young people issue is absolutely the issue, it's key that we engage with this group. And Val, who's also online, we've been looking at some of the evidence around engaging with young people. One thing that we hear is that they want to do the right thing. They don't always have the same trust in institutions that the older people have, so it depends who gives them the message, and they're often in a situation where they find it more difficult to follow the advice because of the other circumstances, their jobs, where they live, etc. So we're doing a lot of work looking at the evidence around how best to communicate with young people, and we're doing that as a system, absolutely, to address the points that you raise. And I would also like to say that you've pointed out that there is this screening going on locally. And while we have this very sudden increase in rates in Cambridge, if you compare Cambridge with some other university towns, I would say there has been some success in containing the rise in COVID, because rates actually have gone much higher in some other university areas. And that is the worry when all the students come back into Cambridgeshire from everywhere else in the country. So you're absolutely right about that. I think there's the worry about those young people coming back. And some of them are likely to have been tested through the new lateral flow type tests. I think ARU will be doing some of that, other universities will be doing some of that. So there's likely to have been some testing going on. But young people will come back, they'll want to see their old friends, who weren't at university with them. And so this also will be at the time when everyone's coming out of lockdown, and with the surge that we saw before lockdown, we equally need to be concerned about behaviours straight after lockdown. So that's absolutely what the officers across the system are planning for and are concerned about. So we are looking at our communication strategies right across the system, looking at the evidence on communication and looking at the practicalities of how we can reach the people who are most likely perhaps to have those behaviours which may lead to spread. So lots of work going on that. We are also looking at how we can work with our hospitality sector and how we can support business, but also how we can promote and if necessary enforce COVID safe behaviours amongst the hospitality sector if that sector reopens. And of course, we're all waiting for the national announcements on what will happen post-lockdown. But what we need to do locally is to, in a sense, plan for the lightest national restrictions so that we have our own local plans in place to deal with that, depending on the outcome of national discussions. So that's
okay, Liz, yeah. Thanks very much. I just have to say it would give me enormous personal pleasure to be able to go out and meet my friends too, but I'm not. Perhaps our young people should be the same, and then we'll all get out to see our friends a lot quicker. Sarah, please. Councillor Wilson.
Thank you. We've been hearing good news about vaccines in the press this week, and I hope that you see that as a kind of light at the end of the tunnel. I was wondering how we are in Cambridgeshire with looking at a plan for mass immunisations. And at this point, I think I should just declare an interest to Rob that having from yesterday been employed in the CCS COVID immunisation team. So I think I just need to get that recorded, please. But I'd like to know where we are across the county.
Thank you, Sarah. Yeah, we've got that register of interest. Liz, please.
Yes, and I think that it is very positive that we have that hope for people to look forward to. We are getting increasing hope that this is not a never-ending situation, that we are likely to have effective vaccines, though they haven't yet been approved by the MHRA. The outlook is much more positive. I would say that this is not an immediate solution. So really, with the best will in the world, I wouldn't expect this to be having a huge impact until we get into next spring, just given the pace at which vaccines are likely to come through and the numbers of people who live in Cambridgeshire and Peterborough and so on. So I think there should be no complacency. We need to contain COVID for quite a bit longer until we have an effective vaccine that kicks in. In terms of the planning for mass vaccinations, that really sits with NHS England and the NHS. So I don't think it is my place to respond on that here as Director of Public Health. That would have to be a question to our NHS colleagues who are leading on that planning.
Thank you, Liz. Just to remind me, we've got six minutes left, please. Lorna.
Yes, my question follows on in a way from Councillor Sarah Wilson's about vaccines, and I'm sure we all saw the list of priorities for administration of a vaccine when it eventually does become publicly available. And you may, if you're like me, have looked to see where you or those you know were on that list of priorities. The thing that concerned me was that teachers were nowhere mentioned on that, despite the fact that there is every pressure to keep them in the classroom, in front of children, with children without masks all day, for understandable reasons. And I understand what those reasons are and the need to ensure that education carries on. But it seems to me that teachers are at a much greater risk of catching COVID-19 than I am, as someone who is 8th in that list of 8 priorities. I don't go out, I don't mix with people. And in a sense, if I were offered a vaccine, if I could swap my place and give it to someone who was a teacher, I gladly would. And I would very much hope that local government collectively would be arguing that case with government and that we would be in the forefront of that.
Thank you, Councillor Dupre. I think that is a very good point, because of course we need all our key workers delivering our services over the winter absolutely need our schools to be functioning, to look after people, to teach people's children, to provide education, but also that is helpful for the whole system. So in Cambridgeshire and Peterborough, we have put in a very good system for rapid testing of teachers to make sure that they're not sitting at home waiting for a test if they have COVID. So we are very aware of those issues. I think when I kind of need to bow a bit to the Central Vaccination Committee around the evidence base on this when it comes to the priority order of vaccination. I think they would absolutely respond to stakeholders and would respond to the evidence. And perhaps surprisingly, some of the earlier evidence around the likely infection rate for teachers was that it was not significantly raised, whereas some other population groups like taxi drivers, healthcare assistants, security guards had a very significantly increased rate. I think we can certainly encourage the decision makers to look at that evidence again and to make sure that they are looking at this in the round and to emphasise the importance of teachers as a staff group. But we also have to be aware that they will be looking across the piece at the evidence, and we just need to encourage them with the importance of teachers, but they will also want to look at some of those actual evidence of risk.
Thank you, Liz. Thank you, members. So that's it. Thank you, Liz, again. Please pass on our thanks, obviously, to you and all your team for the very fantastic work you're doing. I know you're extraordinarily busy.
The whole team is very busy, working incredibly hard and doing a great job, I have to say.
Yeah, yeah. Thank you. Hello, Graham. You're waving at me.
Well, I had my hand up, Peter.
But it's gone.
Well, it's still here on my screen.
Oh, right. I'm sorry. It's not on mine.
I appreciate Liz is going, so this may be something, Peter, that you can deal with, or it goes back to GPC. Two questions. One is the £8 per head, so £5 million for us, enough? And then the second, more importantly, because we're the health committee and I wasn't sure where else to go, I wanted to raise concerns that have been expressed to me about the health and well-being of our own staff, because many of them are feeling extremely overworked, as Liz has just described. Many of them are working from home in conditions that are not ideal and are missing out on the social interaction that they would normally have with other staff. So I just feel that from all that little lot, it's hardly surprising that morale is quite low amongst many staff. And are we doing absolutely everything that we can to try and support these folk during this difficult pandemic?
Yeah, I mean, I can answer that quickly if I can. £8 enough? No. Is £15 enough? No. Are our staff being looked after? I believe they are. I believe they're being looked after really, really well, and everybody's doing their best. Liz, can you go back on that quickly, please?
Yes, I would say that it is an absolute priority for the joint management team at both councils to ensure the well-being of staff. So we have sent out messaging for staff, sort of corporate messaging for staff recently, encouraging people to take time out of work so that they can walk outside in the sunlight or in the light during the day. We've asked people to try to not fix meetings over the lunch hour so that people can have a lunch hour. And we've asked people not to send emails at all hours of the day, and if they do, to because people do like to work flexible hours, to try and ensure those emails arrive the next morning, rather than people feeling that they have to look at their emails all evening in case something comes in. And we have some very active programs going forward through the staff health and wellbeing group, with webinars where people can actually come in and discuss their health and wellbeing issues. A lot going out around mental health, around supporting people to work at home. And it is a really tough time for staff. It is really busy. And I think there is an issue around when this started, everyone was kind of entirely working on COVID, and now there are these expectations that people will do the COVID response work, but also will be doing all the other work. So I think that again, joint management team is very aware of. I think councillors are aware of that, and we need to work. That there is absolutely that need to ensure that we prioritise that correctly. But I can assure you that is absolutely the forefront of the chief executive and the joint management team's thinking around maintaining. I mean,
that's absolutely excellent. It's just that the feedback that I'm getting from a number of officers is that it's not yet working. So are we undertaking anonymous surveys to enable staff to express how they really feel, which may not be the same as what they tell their managers?
Yes, we are undertaking pulse surveys. That's one of the things we've introduced for this period, because we know that that's needed. And so the feedback that comes back through those surveys will be responded to.
So is this, Peter, something which could come back to a future meeting of this committee, as this seems to be the most relevant committee to consider health and well-being of staff?
Yes, I will look at it, and I'll also discuss it with the chair of the Health and Wellbeing Board.
Thank you.
So we'll both look at it.
Yeah, absolutely.
Liz, you need to go.
I do. I would just say that there might need to be a discussion with Democratic Services in terms of the corporate HR function, which would normally oversee the health and wellbeing staff, compared with the health committee. So I just think that offer discussion might need to go on.
Yes, it will do.
But yeah.
Okay. Thank you, Liz. Off you go to your meeting.
Thanks.
Thank you very much. Thank you, members. We're asked to note the progress made to date, which we have done, and we've also passed on our thanks to all our great public health team. So if you go back to your agenda, please. I believe now it's item 8, the healthy weight in Cambridgeshire. Val is here, our Deputy Director of Public Health. Val, do you have a very brief introduction, please?
Yes, I'll be a brief introduction. Also, I'd like to introduce Singh, who's one of our public health registrars who's been working with me on this.
Welcome, Harry.
Right. I think I'm glad that we've now gone back to the healthy weight strategy, just to say that at the beginning. It's been called obesity, but I think there's a consensus that it's a much more encompassing terminology to use the term healthy weight. Anyway, this work reflects very much the Health Committee support for addressing healthy weight, and very much this paper is being driven by the work that's been taken forward, what I call the Blue Sky Thinking member group, which is led by Councillor Hay. And we have mentioned before that we had a workshop, but this is bringing together all the ideas and proposals for taking it forward. I think there's some key themes in the paper, which has come out of the work, stressing that healthy weight is a system-wide approach, requires a system-wide approach. It's complex, it's throughout a person's lifetime, and there's an element of health inequalities in it. And then when we put this into the COVID situation, we know that COVID and obesity or healthy weight is a problem in terms of outcomes. So the paper does a quick run through the evidence, which the headline evidence, which is considered to be essential in addressing and achieving a healthy weight. It also looks at what we are doing as a system. So very much what we commission and the work that we support, but also what other organisations are doing. And it also brings out in there the opportunities that COVID has brought. Certainly part of, I know perhaps calling it recovery is now it's sort of moving forward. We did at the beginning of this pandemic have a whole recovery structure, but it's more about living with COVID at the moment. But certainly obesity is being picked up in various groups that are contributing to this work. And we have started to see it come through in some of certainly in the environment group. And secondly, prior to lockdown or prior to the pandemic, the whole organisation and the whole system became very much engaged in using the Think Communities approach, very much working with communities and very much acknowledging the power that communities have. And this has been taken forward certainly in terms of the response to COVID, and our communities are playing a very important role. But it's going forward. We would like to see that role really picked up on by communities. They do an awful lot at the moment, but there's so much more for them to do. And having that Think Communities awareness and the way it's become embedded in the system would be very important. So it's a difficult time at the moment in terms of, yes, we are going to go in and sort of really get started on addressing obesity. Realistically, I think in the next number of months, really starting new things is going to be difficult. But what we always struggle with is that certainly I've been working in this field for quite a while, and I feel that a system-wide approach is absolutely essential. But although I think we've done an awful lot of things in different parts of the system, and I think this was very much a discussion that was had in the workshop with members of the Blue Sky Group, that really, are we really joined up across the system? There are bits of integration at different parts, but perhaps we need to go further than that. So the proposal in this paper is to commission a time-limited project to identify the barriers and enablers to having a system-wide approach, a fully meaningful system-wide approach to healthy weight in Cambridgeshire. and also identifying what are the priority areas that will have the most impact. To take this forward, we're requesting the Health Committee to approve £80,000 to commission this work. I think it needs to be undertaken by a fairly senior person who's had experience of working within systems and would be able to look at the barriers and enablers and have those very pertinent conversations. But also alongside of that, as we are in a situation whereby people who are experiencing unhealthy weight are at higher risk of poorer outcomes from COVID, and to have, we did do one short campaign last year, but to have another program of awareness, which again would say be a good prelude to taking forward the wider work which any forthcoming report emerging from this commission would produce. So I'd be really grateful if the Health Committee could consider these recommendations, and obviously Harry and I will answer any questions.
Thank you. Members? Start with Linda. Linda, Councillor Harford, please.
Thank you, Chairman. So I've got a few comments to make and one or two questions. So first of all, I looked really carefully at some of the things that are being suggested, and I would say that we need to be careful about giving support to pricing people out being able to use their cars. Public transport in our rural villages is laughable, and at least if people can get to a place in their cars, they can do something when they get there. So I do think we need to be a bit cautious there. I think that we need to take advice from CPFT's eating disorder specialists about the right messages, because there is a definite link between bad eating habits that lead to obesity and subsequent eating disorders. I wasn't quite sure how we'd use planning and licensing powers to increase access for food for preparation in the home. So perhaps I could have that clarified, please. I understand about restricting takeaways and things, and in fact, in Cottenham, we had a very successful experience at stopping somebody opening a kebab shop close to the schools. I would like to think that we would put more emphasis on takeaways and restaurants to limit portion size and use healthy ingredients. And I think there also needs to be more education around portion size for home cooks. I think that's one of the places where portion sizes really do expand. The last thing I'm going to say is something I feel incredibly passionate about. That's encouraging walking. And I'm going to ask again, what more can this committee do to influence a greater budget for footpath maintenance? Across the county, residents and their local members are complaining about the condition of footpaths. They are not conducive to encouraging walking. Thank you for your patience.
Thank you, Linda. I'm not quite sure Val will be able to answer your question on footpaths. Perhaps we should put that to the Highways Committee, who are looking at the budget for footpaths.
Can I just say that I'm on that committee and I preach that gospel loud and clear, but I do need somebody with a bit more influence than me to come in behind me and really give it some welly.
Okay. I'll do that if you want that. I'm happy to do that. Okay, thank you, Val. Do you want to go back on Linda, please?
Yeah, I think the first point about cars, it's not, I think I'd recognise very much the rurality of parts of the county, and it's not saying don't use your cars. It's creating a culture where there, in some circumstances, there are alternatives to using the car. So it's not a sort of stop using your cars. For some people, it's absolutely essential. But it's sort of using, it's thinking about it, are there opportunities, and to get away, I think it's a culture of dependency on the car. You think, oh, I'll just pop down the road, I'll get into a car. So, but again, I think you have to have a more granular approach to anything and recognise that it's a different approach in different areas. But as a general thing, let's not automatically use our cars, but think about other ways as well. The eating disorders, I think absolutely. I think that again relates to the system-wide approach. You wouldn't do anything in any isolation, and we've had a good experience of working with dietetics departments. I think it's probably the wording in your comment about planning and licensing, and I think very much you made the point about fast food outlets, but I think it's more about if there are fewer of them, it will increase that acceptability of thinking about cooking using ingredients. So perhaps it's a strange way of expressing it, but it's by having less of one might improve access to the other. There was a question about the walks, and was there one other as well?
That's the walking.
Yeah, there was the walking.
There was also, I talked about messages for portion sizes, both.
Yeah, I think if we had Imogen here, who's actually now gone on to maternity leave, our nutritionist, she would absolutely endorse that. And I think this is just sort of picking up on some of the stuff perhaps we need to develop more. There's lots of things out there we should do, and there's a very strong evidence base around portion sizes. And there's also an evidence base of how those can be promoted as well. Sorry, Harry, do you have anything to comment on that? But I know.
No, I agree. The only thing I would add is, so in terms of that wording around planning and licensing to increase people making food at home, as Val said, it is both the idea that by using those licensing permissions to reduce the number of takeaways, but then also when we are planning to make sure that when we are looking at things like housing developments, that they have access to a local greengrocer or a supermarket where they can actually purchase food for preparation in the home, and where we have communities where we have high numbers of takeaways, and we start to use licensing powers to reduce that, to then try and make sure that the people coming in are supermarkets. And the other thing on portion control, I completely agree. And we have talked about how we can try and work with local businesses to do that in restaurants. But as Val says, there's definitely a bigger thing around that. And one of the opportunities would be education through schools to try and get it into children early about how to work out what is an appropriate portion size, and working with CPFT throughout to make sure that we're using the correct messaging.
Yeah, thank you, Harry. Lorna, please.
Thank you. Two things I wanted to ask. The first thing is that there didn't seem to me to be in this document any reference to a project that we've been engaged with as a county council for quite a while around putting these people who are called, I can't remember whether it's Get Moving or Get Active or something like that.
Let's get moving.
Yeah, and I would have expected during the last 6 months to have seen a lot more of them, and to see them doing a lot more around promoting activity where it can be done. And certainly lockdown 2 is different to lockdown 1 in terms of there is a greater emphasis on encouraging people to get out of the home and get moving around outside. But I've not really seen as much as I would have expected to see around Get Moving or Get Active, or sorry, I've already forgotten what it's called. And I would have liked to know how that is envisaged as contributing to this, what it's already done, how effective that is being. There are so many opportunities for walking groups and trim trails and Tai Chi on the village green and all of that sort of stuff that I'm not really seeing, and I don't know why. My second question is about partners. And who we envisage as being partners in this. And it comes back actually to this issue in part about cooking at home and all of that, and planning and licensing, because many of the new properties that are being built or have been built recently contain absolutely minute kitchens. They are an absolute afterthought. And I've been in a property that was built comparatively recently, in the last 10 years, say, where it was impossible for 2 people to be in the kitchen simultaneously, and where there was absolutely no room in that kitchen to store. You could just about store a few ingredients. You couldn't store any cooking equipment. The cooking equipment was a microwave. And that kitchen seemed pretty much entirely predicated on the assumption that people's meals would be ready stuff out of a packet, that they would put in the microwave, or that they would just add water to or heat up in some way, rather than actually cooking. And it did strike me that we have in the Combined Authority a body that is putting large amounts of public money into the construction of property. We discovered recently that they were not holding any information about the carbon footprint of those properties, nor were they holding any information about accessibility in the longer term in terms of lifetime homes and how the property they were putting money in contributed to that. I'd be interested to know about the Combined Authority's contribution as the funder of new buildings, the extent to which they actually take seriously space standards, and in particular the opportunity in new properties for people actually to have space to cook anything. Thank you.
Okay, I'll take the first question. Let's get moving. I'm not certain, are you talking about prior to lockdown, or you mean prior to the pandemic or during the pandemic?
I kind of, perhaps both, but particularly I would have expected them to have come to the fore during lockdown, and I'm not sure I've seen that.
Okay, well, they certainly are mentioned in the paper as part of the integrated health service, because they're part of that whole service now. And I think briefly before lockdown, we did evaluate it and did get some very good information back. In lockdown, it has been problematic because a lot of the activities were group activities. And when things did, the restrictions became less constricting during the summer months, it did pick up, but then it fell off again, partly because, and it's quite difficult because one moment, I think the perception is that, well, it's okay to go as a group, and the next minute, how many do we put into a group? So it has caused some consternation in many circles. But what they have done, they have, and in fact, I've got a meeting later today, in fact, on developing another online resource specifically around how to be physically active. And we've promoted there's been lots produced. And we have promoted those a lot. They've played a role in that. They've supported the work of the weight management services, because a lot of the weight management has been done virtually, and they've supported that. It has been rather difficult because Let's Get Moving has been part of district council teams. So it's been part of those to join up the different activities of what the districts are providing. But a lot of those activities are for obviously the same reasons of not being able to function in the same way. So they've had to find a different way of functioning. And I think the realization is very much now, as this has gone on much longer than anticipated, and will go on for a little while yet, as Liz indicated earlier, that this need to find different ways to encourage people and provide support, not actively in a hands-on situation, but more virtually, and providing with the information. And I think that it's very difficult now as we're in lockdown, and it does create a lot of confusion. And part of their role is to give clear messages, and what we help them with is saying, okay, this is what you can tell people that they can do safely. So it's been a difficult yo-yo between what they can do and what they can't do, and that's created a lot of issues for people, them understanding what they can offer and them understanding what they can provide. Okay. I know that sounds a very long statement to say what I'm trying to say.
Val, can I ask a question? Let's Get Moving, etc. We give money to that, do we not? We give money to the districts. Now, if that's not taking place because of lockdown and because of COVID-19, are we getting our money back, or have we stopped paying for service we're not getting?
I think it's been an organisational. I don't think a lot of services across the whole authority could take that role, to take that perspective. And certainly in the first 6 months of lockdown, there was an expectation that public sector employers would continue to fund no matter what.
What's the point of funding something that isn't happening? So where's the money going? Because nothing's happening.
It's happening in a different way.
Convince me.
Well, it's a development of resources. so that they can support people virtually. They'll talk to them on the telephone. But it's a bit of a laborious task in many ways.
Okay, this is something I'll take out away
I think
from
it's
this,
a wider.
this meeting.
I think it's quite a wider issue, Peter.
I'll take that on myself out of this meeting. Nikki, please.
Chair, I did have that second
Oh,
question.
I'm sorry, Lorna.
About kitchens
yeah, sorry.
and so on.
Yeah, I'm sorry.
Yeah, I cannot comment on what the combined authority undertakes, or other authorities or other organisations that are building housing, and I think that probably sits beyond my remit. But part of wanting to commission a person to work with different organisations to tease out the barriers, part of that is to tease out those types of issues, and I think that discussion and that dialogue would need to go on in many areas of the system, because it's a very broad topic and raises lots of issues, but I think it is a point. I think small kitchens does not facilitate the types of cooking skills, but I think part of the role that we have, that if people do have those challenges, is to present them with workable alternatives.
Thank you. I think my point was that they need to be regarded as a partner for that reason, if no other, and I hope they would be. That was
and they do, and I certainly work with them in a different way, and on a work and health and working with DWP and the combined authority. So I think there is a relationship there, and this is obviously a factor to be considered.
Okay, thank you. Nikki, please.
Yes, I think it's interesting to see the success of that chap that was doing daily exercises, whose name I've forgotten, on TV during the first lockdown, and which tells you that people do want to engage. Or people.
Yeah, but we're not giving him any money, are we?
We're not giving him money, no. But incidentally, I actually could come back up to Peter, because I'm trying to remember when, but I sat on this committee before when we've mentioned about the safety of pavements and the impact it has on different people, including the elderly. And I think you said that you were going to chat to the highways chair about it.
I did, and I have, and I spoke to him again last week, and they're looking at a budget line for it.
Okay, thank you.
No problem. My pleasure. Linda, please. Linda Jones.
Thank you very much. Interesting how many things the systems approach throws up. Could I just return us to the 3 recommendations, which I think are absolutely crucial? And I think this is, and to very much welcome this paper, I think it's a really important step ahead in terms of dealing with what is, healthy weight and obesity, overweight, extraordinarily difficult area. I think the footpath and walking issue is really important. I mean, certainly in my division, cycling is very well known, and there's a very strong lobby. It's a very weak lobby, or no lobby at all, for walking. Yet everybody, whether they are a car driver or a cyclist or whatever, all walk. And I think Linda's point about footpaths and walkways is extremely important. I wanted to flag also the fact that the 3rd recommendation, which is about an awareness raising, I think there's a lot of bad news about things that go wrong. And one of the things, in a way to make this a good news story, we have to find the good news examples. And I was interested in the example of a Cottenham campaign which actually stopped a kebab shop being opened. And I've got a couple of examples like that where we've stopped alcohol licenses being used, for example, in my division. And I think those sorts of issues, carefully used as stories about the importance of healthy weight, are not to be underrated, because I think the communication strategy is, I mean, to think about advertising. Advertising for health is incredibly much less effective than advertising for unhealth, for McDonald's, or for excessive fat in foods and large portions and so on. And I think we have to get a lot better at advertising for health. And so I'm very glad to see the 3rd part of this recommendation, as well as the first 2.
Thank you. Val, do you want to come back on anything? Briefly sum up.
Not well. Briefly, I support what Linda, I think, has sort of echoed many of the things that are in the paper. So to sum up, I would say that a systems-wide approach is absolutely essential. I think we need to use this opportunity in the next few months to be ready to really start moving on it, hopefully in not too long in the distance. But I think the Blue Sky group felt that there were some things that needed to be done to identify those barriers and enablers that will really lead to a comprehensive system-wide approach. And that was why we had the request for the approval of funding to have. And I will stress this, I think you need someone with experience and seniority who will be able to go to the combined authority and ask the questions. And also to take part in this ongoing awareness raising, because it has to be continuous.
Okay, thank you. Members, we're asked to agree the following 3 recommendations. Recommendation A, to commission a time-limited project to identify the barriers and enablers for addressing the healthy weight within Cambridgeshire for a system-wide approach and the priorities that will have the most impact. Recommendation B is to allocate up to £80,000 to the project, which will also include drawing up an implementation plan that has partner commitment, important, partner commitment and involvement. And recommendation C is to lead and work with our partners on the immediate development and delivery of a programme of awareness raising and a campaign targeting those most at risk of the poor outcomes from COVID-19 that are associated with obesity. We're asked to approve all 3 recommendations. If anybody does not agree with all 3 recommendations, can you please use the raise hand symbol? I see no hands. Splendid. Because Val's brought back exactly what we've asked for. So thank you very much. That's okay, Val. That's all agreed. Thank you very much indeed.
Thank you for the support of the members involved in what I call the Blue Sky Thinking Group.
The Blue Sky Thinking Group done good again. And thanks to the Vice Chair.
Okay, thank you.
Okay, members, can we move forward, please, to item 9, which is page 55 to 58. And on your agenda, you will have read the agenda plan as published. Rob, anything you need to add, please?
Yeah, thank you, Chairman. To bring the committee up to date and further to suggestions made at recent Chairman and lead member meetings, who, taking into account the extreme pressures our public health officer currently facing with the second COVID-19 wave, and the need to reduce the number of reports formally considered at the committee, and in the short term reduce the number of meetings officers are required to attend. Proposal is that we cancel the January meeting and move all the items to what was the current reserve date in February, and now confirm that as the next meeting, that would be the next meeting after our forthcoming December meeting. In addition, and I've included it in red on the agenda, those that are for information, it's suggested they are sent around by email, and the report on quality accounts would be added to that list. And a proposed addition to the scrutiny section for the February meeting to ask for a presentation on the upgrade at the Princess of Wales Hospital. And again, in line with previous requests, an addition is proposed for the 11th of March meeting to receive a report, I should say, analysing how the Public Health Service worked with the voluntary and community sectors during the COVID crisis and how service delivery has changed.
Thank you, Rob. Liz has had to go, and Kate is also working. Val, please.
Could I just, in terms of the voluntary sector, I think, was it broader than that? Was it, I think the discussion was about how all our services have worked during COVID.
Yes, it was. It was in particular looking at our work with the voluntary sector, plus let's have a look and learn about how we played ourselves within this pandemic, see what we did, how we did it, and how well we did it. And those things we didn't do as well, we learned from. I think Linda, as in Councillor Jones would confirm that because it was her suggestion. Yeah. Yeah. Thank you. Thank you, Val. Kate, do you want to come back, please?
No, I've just everything you just said. It was more of a recovery kind of.
Okay.
Yeah. Lessons
Recovered.
learned. Yeah.
Yeah. Thank you, Graham Wilson.
Thank you, Peter. I just wanted to reinforce my request that we have, either we or somebody else has a paper on the health and well-being of staff during the current pandemic, and either include that within the agenda plan, ideally for next time or probably for January, or if we decide it's not within the remit of this committee, to get a note in the minutes as to which committee will be considering it.
Yeah, we'll put this on the agenda for the next chairs, vice chairs and lead members meeting, where we'll discuss it with our senior officers to see where the best place for this to go. So that will be dealt with. Yeah, thank you.
Thank you.
Unless any members have any other proposals, and bearing in mind we are trying to restrict forthcoming meeting agenda sizes, I hope they can agree to the proposed changes and to note the agenda plan as amended. Thank you. So you will note that the date of our next meeting is in fact on the 3rd of December, which is very, very, very fast approaching. So this is the end of the current agenda. Thanks very much, as always, for your attendance and your great work as always. So, and I look forward to seeing you soon. You keep safe, everybody. Thank you.
Bye, everyone.